Why the Centers for Disease Control wants millions of Americans to get their livers checked. That's coming up. First tonight, the state health department is on the lookout for the West Nile virus, which of course is spread by mosquitoes. Joining us in the studio, Dr. Catherine Feldman, the state public health veterinarian. Dr. Feldman, thank you for being here.
I'm glad to be here.
Why the concern about West Nile? What is it?
So West Nile virus is a virus. It's transmitted by mosquitoes, and so we typically start seeing cases sometime around now, late July, early August. That's when mosquitoes are most active around here, and that will continue through September.
All right, so let's focus on the disease for a second, and then that method of transmission. How do you know you have it? Are there symptoms?
So there are symptoms. The vast majority of people who are bitten by a mosquito and infected actually won't have symptoms, so that's the good news. Around 20% of folks who are infected will develop a fever and some other non-specific signs like headache, malaise, and they just won't feel well, achy joints, and that will resolve on its own. So that's also not a horrible thing. There's a small percentage of folks, around 1% of folks who are infected, who develop very severe disease. And so they can have meningitis or encephalitis, and they can actually have some pretty bad long-term outcomes.
Is there any way to know if you're going to be in one camp or the other? Like if you've had it before, does that mean that any subsequent infections, if you even can be infected again, would be mild or might be worse?
So we think that an infection with West Nile virus will lead to immunity, so you won't get infected again. There are certain groups who are at greater risk of more severe disease. Those are individuals over 50, and also those who have other ongoing diseases, other comorbidities that might make their West Nile virus infection more severe.
Is there a vaccine for this?
Not for people. There is for horses, but not for people.
Interesting.
Yeah.
Okay, so the mosquitoes, how do they get it?
So the mosquitoes pick it up from birds. So West Nile virus didn't occur here naturally in the United States before 1999. And in 1999, it was introduced into the New York City area and set up shop in local birds there. It first hit the crow population very heavily, but any number of birds become infected and actually are reservoirs of the virus. So they have the virus circulating in their systems. When a mosquito bites one of those birds with the virus, they can get infected and then transmit it either to another bird or to a person.
I didn't realize it wasn't a local thing to begin with. How did it get here? Presumably from the Nile region?
Well, so it has been well known in Africa for quite a while, but we believe it came in on a plane, either an infected mosquito or infected people, and the mosquito picked it up from that infected person, and then it became established in our birds.
Okay, so after hearing all this, I'm not going outdoors again until...
Oh, please don't say that.
Until I pick up a snow shovel next winter.
No.
All right, what are we supposed to do about this?
So we want everyone to enjoy the outdoors, but enjoy it safely. So things you can do to prevent mosquito bites are to avoid the times of day, being outdoors in the times of day when mosquitoes are most active, so dawn and dusk.
Okay.
If you go outside then, you can wear long pants, long sleeves. You can apply repellent. There are very effective repellents out there. There's some other things you can do, like if you're hanging out on your deck with your kids, you can have the fan out there that is circulating the air. The mosquitoes find it harder to land if the air is moving, so you don't get bit so much on windy evenings. You can create that wind effect on your deck. If you want to prevent mosquitoes from getting inside the house, make sure your screens are in good repair. And again, stay in when mosquitoes are most active.
Let me remind our viewers, if you have a question about West Nile, mosquitoes, or potentially some of the other diseases that bugs carry, which we will get to, you can give us a call. We'll have the number up on the screen. You could also tweet a question. Our Twitter address is @MPT News. So I've always heard little puddles that might form in the backyard. Maybe you have a bird bath or something. That's like an invitation to mosquitoes to set up shop.
Absolutely. Thank you for asking about that. So mosquitoes need water to breed. The immature stages of the mosquitoes live fully in water. And so it's very important to eliminate any standing water in your yard, whether it's a bird bath, if you flush it weekly, the saucers under your plants. Make sure those don't accumulate water. Things like kids' toys. There are a lot of things you wouldn't even think about. Kids' toys that hang out in the backyard, don't get played with for a few weeks. It rains. Water can accumulate in the little channels and mosquitoes can breed. So it's very important to do a weekly survey, find out where mosquitoes could be breeding, and just turn it over, dump it out.
What's their range? So if there's a pond or an area of still water down the street, is it kind of hopeless, or do they get around?
So mosquitoes, there are a number of different species of mosquitoes for a start, and they all have different ranges. So it's a hard question to answer. They tend to, if you have mosquitoes on your property, it's likely they're coming from your property or nearby. Now, if you have a stagnant pool down the street, you can contact the Maryland Department of Agriculture's mosquito control program, and they can take a look, give advice, maybe come and inspect. So there are things to do even if there's something off your property that you don't have control over.
If there's something on your property, is there anything you can put in it? I mean, is it worth using some sort of treatment?
So for all the little things you have, just dumping is the best. But there are some good products. There's something called a mosquito dunk that you can put in accumulated water, and it will help kill those immature stages of larvae.
Okay. So, well, let's talk about some of the other things. Is there anything else that the mosquitoes are carrying? There was a case in Florida of something that's hard to pronounce, so I'll let you do it.
Chikungunya.
Which could be a problem, but is a much smaller problem these days.
So chikungunya is exploding in the Caribbean right now, and so there's a lot of concern up here about it. It's another mosquito-borne disease, and it is a little different from West Nile in that it doesn't live in birds the way West Nile does. So it's transmitted directly from person to person via the mosquito. You need that mosquito to transmit it. So we are certainly getting reports of Maryland residents who go to the Caribbean and get bit there by mosquito and come back and develop their clinical illness here. So that's happening throughout the U.S. It's happening in Maryland, and we're keeping an eye out for it to ensure that there's no local transmission, meaning that the traveler who came back to Maryland doesn't then provide a mosquito, a virus to infect another Maryland person with no travel history.
But we have people in Maryland who've had this chikungunya thing already?
Yes, we have. So I think there's 7 cases reported currently to CDC, and we're on the lookout for it.
How treatable is that one?
So just like West Nile, and we didn't talk about treatment with West Nile, the care is mostly supportive. There is not a specific treatment for it.
Unless you're a horse, and then you can get a vaccine.
Well, that's preventive. For a horse, you can get vaccinated against West Nile.
Let's take a phone call. This is Ann in Baltimore City. Ann, thank you for calling. Go ahead.
Hi. Yes.
Hi.
My question is, I live downtown, close to the water. Have a balcony that has a lot of lights on it, and if I put a bird out there for finches, little red finches, would that increase the chance of having mosquitoes?
Thanks very much.
So anytime you feed animals, bird feeders or bird baths, you're encouraging animals to congregate, and that's also enhancing the opportunity for diseases to transmit among those animals, and potentially to have other animals like mosquitoes come there. I don't really think that a bird feeder is going to increase your mosquito population so much.
But if you do decide to do one, maybe you dump the water periodically?
So yes, absolutely. If you have a bird bath, dump the water. If you have a bird feeder, clean it regularly.
Okay. Let's go out to Baltimore County. This is Terry. Terry, thank you for calling. Go ahead.
Yes, hi.
Hi.
I have a question for the doctor. If we find dead birds on our property, is there a number that we should call, and let's say, since we live in Baltimore County, to report a dead bird?
So when West Nile virus was first introduced into the United States and Maryland, we would actually collect dead birds and test them. And that's one of the many ways we conducted surveillance for the disease. Now that it's established in the state, we don't do that anymore. However, we do like to take reports of dead birds, and there is a number that folks can call that I have forgotten, that is hosted by the Department of Natural Resources and the United States Department of Agriculture. And so to report sick, injured, or nuisance wildlife, you can call this 800 number that's readily findable.
Department of Natural Resources
Maryland Department of Natural
perhaps.
Resources, yes,
Okay.
indeed.
How about on the subject of mosquitoes? You see ads for all sorts of products. So somebody will treat your backyard to get rid of mosquitoes. There's some sort of zapper that you connect to a propane tank. Any of that stuff work?
Well, it's going to certainly have some effect on your property. As you pointed out already, mosquitoes can fly. They don't respect your property's boundaries, and so you might take care of some of the mosquitoes on your property, but it's certainly possible that mosquitoes will come in from next door or down the street.
I say we get rid of all the mosquitoes. Can we do that?
It would be tough, but I have to agree with you. I'm not quite sure what a mosquito does for us ecologically.
Let's talk to Thelma in Baltimore County. No, we'll wait on Thelma for a second. I wanted to ask about Lyme disease, which obviously goes through ticks instead of mosquitoes. Right. What are we seeing this year?
So Lyme disease is a problem throughout Maryland, and it certainly has some areas of Maryland that have a greater incidence of Lyme disease, but it's a problem throughout Maryland. So we want folks to take precautions against ticks as well as mosquitoes. And many of the prevention messages are the same. So wear repellent, avoid areas where ticks can be, which is generally the brushy area on the side of paths, at the back of your property, and get ticks off of you.
The problem with those ticks is that they're so small, right?
Right, right. The ticks that transmit Lyme disease and the stage of the tick that transmits Lyme disease most commonly is very small. So it's important to do a thorough head-to-toe tick check within a day. You want to get them off daily. So if you're out hiking, make sure you get inside, take a shower. That will also help get the ticks off of you, and then do a tick check head to toe looking for them.
We've been focusing on people, but in terms of pets, any special precautions in terms of either the ticks or the mosquitoes?
Well, with the ticks in particular, good flea and tick preventive for your pets will help protect your pets, but it will also help keep the pet from bringing ticks into your environment. So it helps the whole family.
Very good. Dr. Catherine Feldman with the State Health Department, thanks for stopping by.
It's been my pleasure.
We appreciate it. Just ahead tonight, who needs to get tested for hepatitis C? We'll be right back with our Your Health segment right after this.
Tune in to discover how kind or cruel time has been to these finds on Antiques Roadshow Vintage Des Moines.
That's unbelievable. That's fabulous.
My gosh, that's amazing.
I think I might shock you when I tell you what I would quote on them at auction.
Oh, I'm hanging on.
Can you guess what values went up, down, or stayed the same? Find out next time on Antiques Roadshow.
Tonight at 8 on MPT. Tonight on MPT. Next time on Midsummer Murders.
Took a stroll off his roof.
A lawyer's apparent suicide may actually be a murder.
Looks likely.
And when the victim's rival is killed by wine bottles hurled from a catapult,
This is a revenge killing.
Barnaby and Troy uncover a wine scam.
They're obviously fakes.
But the auctioneer reckons these aren't even very good fakes.
So what's actually going on?
Someone's gone to a great deal of trouble over this.
Find out on Midsummer Murders. Tonight at 9 on MPT.
Tonight on MPT2.
On Masterpiece Mystery.
Well, there's a sight for sore eyes.
David Suchet returns as Agatha Christie's brilliant sleuth, Hercule Poirot.
Mon ami, it has been too long. Far too long.
Don't tell me the great Hercule Poirot will bother with something like this unless foul play was suspected.
This is a business most dark, mes amis, and I fear we're only at the beginning of a long game.
Poirot on Masterpiece Mystery.
Tonight at 8 on MPT2.
And joining us now in the studio for this week's Your Health segment, Dr. William Hudson, Professor of Medicine at the University of Maryland School of Medicine and Medical Director of Liver Transplantation at the University of Maryland Medical Center. Also with us, Dr. Darren Petoskey, Assistant Professor of Medicine at the University of Maryland School of Medicine, also Director of Hepatology at the University of Maryland Medical Center. Doctors, thanks to both of you for being here.
Thanks for having us.
So Centers for Disease Control is advising that all baby boomers get tested for hepatitis C. Why is that necessary?
Yeah, this was a recent recommendation that came out by the CDC, mainly because this is a population of our society who's at highest risk for hepatitis C. This was a time that we didn't know a whole lot about hepatitis C, the existence of the virus, and so people were getting blood transfusions that contain the virus. This is a time when there was a much more free use of injection drugs, which transmitted the virus, and other common ways that the virus is transmitted. And a lot of these patients don't know they have it, which is why they've recommended testing for everyone.
So, Dr. Hudson, maybe explain hepatitis C in the context of other kinds of hepatitis. What is it?
Well, hepatitis C is a virus, and it is primarily transmitted by what we call parenteral means, which is blood-to-blood contact. That's opposed to things like hepatitis A, which is what we call oral fecal contact, food, water sources, things like that can drive hepatitis C. Hepatitis B is another viral hepatitis that's primarily transmitted by parenteral means, that is blood-to-blood. So, you know, hepatitis C, you're not going to get out in the community. You're not going to get it by touching somebody. We get these questions in our clinics frequently. Can you get it by kissing or hugging or eating food after somebody? No, absolutely not. It's blood-to-blood.
What happens to somebody's liver when they contract hepatitis C? Do they know that they're sick?
Most people do not know that they have hepatitis C. They are asymptomatic, that is, no symptoms. They don't get sick, they don't have a fever. A small minority of people may get what we call clinical hepatitis, is they turn yellow and they may feel bad, but it's a very different virus than hepatitis A, where most people manifest symptoms, and with hepatitis C they really don't.
What do you have in the way of treatment?
Well, the treatment has dramatically changed really over the past 6 months for hepatitis C. So in the past, we really didn't have a breakthrough in treatment for the past 10 years. We were using an injectable medicine called interferon, which causes a whole host of side effects and makes people feel really ill, along with other pill called ribavirin that was taken twice a day. And these medications, as bad as they made people feel, only had a cure rate that was about 40% or less in some people. Over the past year, this has really changed dramatically, and we have medications now in combination with interferon, ribavirin, and some varieties where you're just taking pills alone that offering cure rates now in the 90% range.
Great news.
So,
I read, though, that one of these drugs, maybe it's the newest, I don't know, has an incredible price tag, like $80,000 for a course of treatment.
That's absolutely correct.
Which maybe beats a liver transplantation.
However, right.
But
so I was just about to say the same thing. You know, the price of the medication costs money, but a cure for hepatitis C is priceless.
Are you seeing any issues with getting insurance companies to cover it?
We are seeing some difficulty with this. The insurance companies are asking us to treat the sickest or most advanced patients first, which makes sense. And as we're trying to be preventative and treat people early so that we don't get to a point where they're sick enough to require other healthcare resources.
Let's take a phone call. Baltimore County, this is Karen. Karen, thank you for calling. Go ahead.
Hi, yes, just wondering how long can a patient survive without being on medication for hepatitis C?
Great question. Thank you so much.
Well, it depends on the severity of the disease. If you look at statistics, of people that contract hepatitis C, 80% go on to develop chronic hepatitis C. So you get the disease, 20% will clear the virus, 80% go on to chronic hepatitis C. And of those 80% of people that get chronic hepatitis C, 30% go on to develop cirrhosis or irreversible scarring of the liver. So if you're in that category of people of 30%, then you're in the problem group.
And you know you're sick at that point because you've got jaundice or some other issues?
Well, maybe, because there are people that have first-time diagnoses of hepatitis C with cirrhosis just by going in to see their physician and tested for hepatitis C, and then the building blocks start coming down, and you find out that person really already has cirrhosis but doesn't have symptoms. So people can have cirrhosis and not have symptoms.
How much of the transplant business that you do is related to hepatitis C?
It is the #1 reason that we transplant patients in Maryland and United States wide as well.
Let's go to Cecil County and talk to Walter. Walter, thank you for calling. Go ahead.
Yes, I was diagnosed in '97 with hepatitis C, came out of my blood, and just recently I had 2 major CAT scans, and they're now diagnosing cirrhosis. Is the hepatitis C doing something to me, eating my liver up or something? I don't have symptoms. I'm not yellow. I don't have any pain or anything like that or fever. But they just diagnosed me, but nobody's really answering my questions as far as what's happening to me.
Walter, sir, thank you for the phone call. We'll get you an answer on the air, and best of luck. What would you say? Does it sound like a normal case?
Yeah, I mean, it's pretty typical what we see. You know, hepatitis C is a virus that causes inflammation in the liver. And over time, that inflammation turns into scar tissue. So it's just like if you cut your hand and it gets red and swollen initially, and then after a week or so, it turns into a scar. So that process is going on in the liver for years until you develop enough scar tissue that we call it cirrhosis, which is basically just the end stage of scarring in the liver.
Walter or somebody in his situation needs to see a specialist.
Absolutely.
Yeah. What about people living with Walter? So in the same household, even somebody who hasn't advanced to cirrhosis, who has hepatitis C, how contagious is it?
Well, it's not very contagious, but things that I recommend my patients not to do is don't share razors, don't share toothbrushes, anything that produces blood. Flossing your teeth, you know, you shouldn't use those same instruments when you have a person in the house that has hepatitis C.
So we've made a pretty compelling case here for going to get tested early to follow the CDC recommendations. What does the test involve?
The test is very simple. It's the screening test is just a blood test like any other test your doctor may order. The turnaround time is very quick. It's an antibody test, and that test has to be followed up with a confirmatory test if positive. So the first test tells you if you've ever been exposed. It doesn't tell you if you're one of the lucky people to have cleared the virus on your own.
Anybody else who ought to get tested besides the baby boomers? What did the baby boomers do wrong, by the way?
They shot up a lot of drugs.
Yeah, right, you mentioned earlier it was a time when there was more indiscriminate.
But it was blood transfusions
and blood transfusions.
Too. You know,
Okay.
the blood didn't become safe from hepatitis C until 1992.
So anybody who's had a transfusion pre-92?
They should definitely get tested.
Right.
Yeah. And I think it just in general, anybody who's concerned about it or feels like they may be at risk to have been exposed, the harm of testing is zero.
Right. Let's talk to Fran in Baltimore County. Fran, thank you for calling. Go ahead.
Yes, I was calling to say, does a healthy individual can take on hepatitis C, or there a certain population of folks that are more prone to hepatitis C than others?
Thanks very much. I mean, it based on the drug use history that some would have, correlates with HIV.
That is true. There's a higher proportion of patients with HIV that have hepatitis C because they engage in behavior that would promote that kind of contraction of disease.
Anything else that it correlates with?
Not
That's good.
specifically.
Yeah.
Let's focus on the transplantation operation that you run. The availability of living donor transplants. We only have one liver. Talk a little about how that works and how it's grown.
Well, living donor transplantation has come a long way. It actually was much more popular 10 years ago. And then what happened is there was a donor death in New York City. And so everything cooled off on that in the United States. Now, in many other countries in the world, living donation is the #1 way that liver transplantation has taken place. For instance, in Korea, many more living donors are transplanted there than deceased donors. So here at the University of Maryland, we actually do living donor liver transplantation. And there are 2 lobes. And we take the right lobe, which is the larger lobe, and transplant that into the recipient.
And it regenerates, which is an amazing thing, but we're out of time, so we'll talk more about it next time. Doctors, we appreciate the visit. Thanks for being with us. Thank you for joining us for Direct Connection. Have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.